going to show you a couple of quick examples of methods to tape the foot and the lower leg. I tend to use these techniques that I'm going to show you for people who have foot pain in general, heel pain, diagnosis of plantar fasciitis is a good example of someone I'd use this for. Also just people whose feet tend to hurt more as the day goes on. I use this a lot of times with workers who spend all day on concrete or work all day on their feet. They tend to find this pretty relieving. And you lift up here. So first I'm going to use the white base layer. This is to protect the skin. I'm going to anchor it to the bottom of the foot here. And I'm going to bring it kind of up and around the ankle at a diagonal. I'm going to change my angle out here just a little bit. So that you're getting kind of a upward angle going away from the foot, but you want to make sure to anchor it on the bottom of the foot here. Okay, then the brown layer, this is the layer that does the work. I'm going to make sure to keep it shorter than the white layer because you don't want this tape getting on their skin. This is more irritating tape, it's more adhesive. Always make sure that the people that you're taping are not allergic to tape or adhesive before you tape them. Okay, and the idea is to gather up some skin to make some wrinkles. You should see that there's some little wrinkles in the skin here. I'm going to do this one both from the top and the bottom. And I will use my hands. You can see how I'm kind of using my hands to gather up a little bit of skin as I lay the tape down. When you're done with this, the person that you've taped will most likely feel as if they've got a little bit of arch support as they walk. But this the input through the skin here should make it feel as if the foot is having to do less work. Okay, on the back of the leg and on the foot, this is one that a lot of times if folks are having pain near the Achilles tendon or on the back of the heel, this is one that tends to do well for folks. I've got the Kinesio tape out again. This is the stretchy tape. So I've cut it into two tails here. I cut a long strip of Kinesio tape and I gave it two tails. And what I'm going to do is anchor the solid portion right on the back of the heel. Just like so. And if you use some friction to kind of generate some heat, it should stick a little bit better. And I'm just going to kind of tack these down so they're out of the way. Get them off my fingers here. Okay, and if it doesn't tack down real well, you can always use a white layer of the Endura tape type to fix it as well. Okay, but we're going to basically kind of outline the outside contour of the calf here. And you can see how the Kinesio tape is a little bit stretchy. It's got some elasticity to it. You know, so if there's 100% of the stretch, I'm going to give it about 30%. I bring it around, but you just kind of want to have a smooth kind of contour going around either side of the calf here. Now the other one, a lot of times people have pain if they move their foot one way or another. What you can do is use your hands and kind of give a rotational force to the skin like this, okay? Then you have them recreate that movement. Go ahead and move your ankle to the outside. And if that direction of input reduces their symptoms, then you can tape it consistent with that way. You can do the same thing to the other side, but let's, for example here, let's say that this direction, moving the skin in this direction, was helpful. So what we're going to do to tape that is get our white layer. We'll just put it right over top of the Kinesio tape. This. And what we're going to try to do is basically recreate with the tape what I was doing with my hands. So we're going to gather up skin in the direction we're pulling with our hands. You can see I'm using my other hand to kind of help gather up skin. So we've created some wrinkles here, so we're trying to give a little bit of a force in this direction. You'd be surprised at how often such a simple little taping strip, you'll have them recreate it then and the movement will feel better to them. So then this is something they can wear for up to a couple of days So long as the tape's not irritating their skin, it should help get their symptoms moving in the right direction. That's all there is to it.